When, how, and what should I feed my baby? Well, I'm going to walk you through the latest guidelines on when to start solids, what foods to offer, how to do it safely, and how to honor your cultural traditions in regards to feeding your baby. We'll also review the most commonly asked questions relating to starting solids, and I know by the end of this video, you'll feel confident and prepared. Hi everyone, I'm Lavanya Sithanandam, a board-certified pediatrician and travel medicine specialist based in Maryland. You're watching the Park Pediatrics and Park Travel Clinic channel. If you want to stay in the loop with the latest expert pediatric and travel medicine information, please make sure to hit the like and subscribe button below. So, when should you start feeding your baby solids? The American Academy of Pediatrics recommends introducing solids around 6 months of age, but it's more important to look for signs of readiness than the actual calendar date. Here are the signs. Your baby can sit up with minimal support. They have good head and neck control. They've lost the tongue thrust reflex, which pushes food out. They show interest in what you're eating, maybe even reaching for your own food. So what food are you supposed to start with? There's no single first food anymore. The old advice of rice cereal first, well, that's out. In fact, feeding practices vary across cultures, and that's a beautiful thing. In some parts of the world, like in India, babies are offered soft rice or lentils as a first food. In other parts of the world, it might be mashed fruits, bone broth, or lightly spiced vegetables. At Park Pediatrics, we honor and support these culturally rooted feeding traditions. The important thing is to wait for signs that your baby is ready, as discussed before, introducing safe, age-appropriate textures, and avoiding added salt, sugar, and choking hazards. We encourage parents from all backgrounds to bring their family's food traditions into their baby's journey with solids, just with guidance to keep things safe and nutritionally complete. One of the most important aspects in all cultures is that the first foods tend to be iron-rich foods because babies' iron stores start to drop around 6 months. Great first options include pureed or mashed meats like chicken or beef, iron-fortified cereals like oatmeal, lentils, beans, or tofu, cooked egg yolks, or whole eggs. Yes, it's totally safe. You can also include vegetables, fruits, grains, and yogurt. But try to introduce one new food at a time and wait about 2 to 3 days before adding another food so you can watch for allergic reactions. Speaking of allergies, here's where guidelines have really changed. And to be honest, we've always been recommending this at Park Pediatrics given our knowledge of practices across the globe. We encourage early introduction of potential allergens, especially peanuts and eggs, around 6 months of age, assuming your baby doesn't have severe eczema or another high-risk condition. Peanut butter should be thinned and smooth, not chunky or in whole form to avoid choking. You can even mix the peanut butter with milk or applesauce. Same for eggs. Scrambled or mashed is best. Early introduction may actually reduce the risk of developing food allergies later on. So what about textures and feeding style? You can start with purees, mashed foods, or go the baby-led weaning route, where babies self-feed soft, safe chunks of food. Both are valid options. The key is to avoid choking hazards like raw apples, whole nuts, grapes, or popcorn. Keep food soft and easy to gum, even without teeth. Always supervise meals and make sure baby is upright during feeding. By 9 to 12 months of age, your baby should be eating a variety of textures and feeding themselves more. What about drinks? It's best to stick with breast milk or formula as the main source of nutrition until 12 months of age. You can offer small sips of water once solids begin, especially with meals. No juice, it adds sugar and has no real nutritional value. Fruit is fine though. No cow's milk until after 12 months when it can replace formula or breast milk. And one additional guidance is no honey until age 1. Okay, so let's review some of the most common questions I get from parents in my clinic. What should I do if my baby refuses a new food? Well, that's actually completely normal for babies to reject a new food at first. Don't give up. It can take 8 to 10 or even 15 exposures before a baby accepts a new flavor. Keep offering it in small amounts without pressure alongside other familiar foods. 2, can I use traditional spices or seasonings from my culture? Yes, in moderation. Mild spices like turmeric, garlic, cinnamon, cumin, or ginger are often fine once your baby is tolerating single foods. Avoid added salt, chili, or sugar, but culturally appropriate flavors can enhance the experience and help babies learn to enjoy your family's cuisine. 3, what are the signs of a food allergy and when should I worry? So allergic reactions usually appear within minutes to 2 hours and may include hives, rash or swelling, especially around the mouth or the eyes, vomiting or diarrhea, coughing, wheezing, or trouble breathing. You're going to call your pediatrician for mild reactions. For anything more severe, call 911, like difficulty breathing, limpness, or facial swelling. Number 4, how do I know if my baby is getting enough iron without meat? So there are many iron-rich vegetarian options like iron-fortified baby cereals, lentils and beans, tofu, cooked spinach. And you can pair these with vitamin C rich foods like sweet potato, mango, or tomato to boost absorption. Your pediatrician may also check your baby's iron levels at 9 to 12 months of age. 5, is it okay to combine foods early on, like mixing banana with cereal? Yes, once you've tried each food individually for 2 to 3 days without any reaction, you can start combining. Mixing textures and flavors helps babies learn and enjoy food variety. 6, how much solid food should my baby eat each day? So start with 1 to 2 tablespoons once or twice a day and gradually increase based on their interest. By 8 to 9 months, babies may eat 3 meals and 1 to 2 snacks a day, but every day baby is different, so let your baby's hunger cues guide you. What if my baby doesn't have teeth yet? Can they still handle finger foods? Absolutely. Babies can use their gums for soft foods even without teeth. Offer well-cooked vegetables, soft fruits, scrambled eggs, or toast strips. Avoid choking hazards like whole grapes, nuts, or raw carrots. How do I balance giving solids with breastfeeding or formula feeding? So until 12 months of age, breast milk or formula should still be the primary source of nutrition. You can offer solids after milk feeds or in between. Around 9 to 12 months, you can gradually shift to solids being the main part of meals. So some final tips and encouragement. You want to remember that mealtime should be fun and low pressure. Your baby may make faces or spit food out at first. This is totally normal. And it may take 10 or more tries before your baby accepts a new food. Just keep trying. Also, have you tried baby-led weaning with your baby? Or are you curious about how to start? Let us know in the comments and look out for a future video on this topic. Please don't forget to like and subscribe to our Park Pediatrics channel for more child health tips and travel medicine information. Thanks for watching.